Depression is very common. I mean, there are some special forms of depression which are a bit rarer. They may be physical causes such as having thyroid disease or dysregulation of the steroid hormones or calcium. Sometimes depression comes from head injuries or tumours in the brain or psychosis or dementia. Sometimes it accompanies trauma, sometimes it accompanies anxiety. But the common cause of depression is often multifactorial. There's often a genetic component. Someone in their family had depression. There's usually a psychological issue. They may have had self-esteem issues when they were in school, or they were bullied and lost confidence. They might be perfectionistic and struggle with the demands of a job because they try and do too well in the job and put pressure on themselves. There can be certain psychological crises, such as partnerships breaking up, or children's illnesses, or job insecurity, usually working on top of a genetic predisposition and a psychological predisposition produces a depression. Now, not every depression needs psychiatric treatment. There are a number of depressions that are self-limiting. And if you can tolerate that emotional distress, you don't necessarily have to get treatment. You'd probably want to get treatment if you can't tolerate the distress, if you are becoming suicidal, or if your functioning in life is markedly deteriorating and you and everybody else are getting worried, then you'd probably want to seek treatment. My own view on treatment is that it should be completely multifactorial. So there could be a role for medication. There should be a role also for psychology. There's probably a role for exercise. There's a role for treating any medical conditions such as chronic pain or sleep apnea. There's a role for intervening in conflict with the boss at work. There's a role in treating any drug or alcohol problems that have either come in secondary to the depression, or they're actually causing or exacerbating the depression. It's a comprehensive approach. It's not just because we're a psychiatrist, you're going to come and see us and we're going to give you medicine. Our first step is to try and analyse all of the factors, then weight the different factors, and then intervene in a way which is productive without causing side effects and taking a wider view as possible. Many depressions don't need medication. Many depressions simply need a social intervention, or they need a brief psychological intervention, and they can evaporate.